So what's going on with Snow White?
So one note that was just weird to me throughout the movie was that they keep calling her Little Princess, and I don't think she's young. So I just think that as compared to Carrie, there's more of like an overt comment on like her size generally. And I think it's interesting because she kind of, I don't know if everyone else felt this way, but she really, Snow White just really annoys me as a character.
Oh, go with that.
Because she is so, she acts like a child, even though she's not a child.
Do we have an age on her?
I mean, she doesn't look like a child. I don't know, maybe she is a child, but they didn't animate her.
For some reason, I thought she was like 9 to 11.
What? I thought she was like 16. Yeah, I thought she was like almost an adult.
I think I'm thinking of Coraline. Go ahead.
It says 14 when I googled it.
Okay, well, there you go.
She doesn't look 14. She looks like a woman.
Well, again, that speaks volumes.
Yeah.
I mean, we're all over the place with her age. She looks older than stated age, etc. So that in itself, I think, is going to influence where we're going with this.
And like, I mean, regardless, I guess it's even worse if she's younger. But she's treated very much like a child. She acts like a child. However, her stepmom still thinks she's this huge threat to her, and her vanity and the perception of her from others.
So mom's perception that her daughter is a threat, in this case stepdaughter, but daughter's threat. By the way, I don't think there's a stepdaughter here. As a matter of fact, I think in the original tale, it's her daughter, biological daughter. I think it's the Disney recreation of Snow White being a stepdaughter, which brings up another whole motif.
They try to make it more acceptable that she hates her.
Yeah. But let's stick with the idea that this is her biological mom. And we could quickly see a parallel with her and, is it Margaret White, Carrie's mother?
Something like that. I think also, like along those lines, especially if it is her biological mother, if we're going on the assumption, obviously, that eating disorders, not the assumption, but the knowledge that eating disorders are like informed by trauma, particularly maternal and child relationships, then her mom, or the queen, has some eating disorder herself, and she is triggered by her daughter and the perceptions of her daughter and her perceptions of her daughter. Or if she really is that young, maybe she has a particular body type that mom doesn't have anymore or whatever. So I think, like, interestingly, to think about her as a trigger for her.
There's no doubt about that. I mean, this is a mom who sees her daughter as a threat to her own beauty and therefore her own self-worth. And we could look at this biological mom as perhaps being at risk for something, again, along the lines of an eating disorder. And we could see this depending on the, well, it's really not going to be Snow White's age, but as some kind of manifestation of the Freudian Electra complex. I mean, this is a mom threatened by her daughter, and what it means that her daughter is becoming a woman, which again is very consistent with Margaret White. Flip-flopping back and forth, is it reasonable to assume, and I know we're provided some information, I don't know how reliable it truly is, but might Carrie's mother blame her? That is, Carrie for, quote-unquote, sending Dad away or sending the person I loved away? I mean, her recollection of the details is provided, but I'm not sure if it's really reliable, right? And we see something very similar here. There is a fear in Snow's biological mom, right? And it really does constellate around a mirror. It really does constellate about body image and this daughter of mine becoming a woman and what threat that is. That's the Electra complex. And again, we see this complex play out. Now, biological mom here is a little older than what we would expect someone struggling with the Electra complex to have to experience, right? We're talking Electra complex 5 years of age. how do we make sense of that? She might be 25 or 35.
I mean, it just was never resolved.
Yeah. So now we get a little bit of a peek. Again, the magic of the mirror, right? Through this lens, through this looking glass, we actually get a peek into what a 5-year-old mom of Snow White would struggle with. We don't know the prequel to this, but we can begin to think through what may be evidence-based and consistent with Freudian theory. Right? So there's something unresolved at the age of 5-ish for this mom that now we see some traumatic reenactment towards her daughter. All right, enough about mom. We've been too harsh on moms. Let's focus now on Snow. What else is going on with this character? Other than the fact that she might be precocious or too childlike or all over the place.
I don't know if this is like a Disney reenactment thing or if this is really how it's meant to be, but when she first finds the dwarves' home, she's like acting out the role of like caregiver because she's cleaning, she's cooking, she's doing all these things. And it seems, especially if she is younger, it does seem like she's playing a role rather than acting on like what she actually wants to be doing at that age.
Yeah. You know, given that she might be 14, her interaction upon entering the dwarf's home seems a bit inappropriate. Put some words, a little bit of just a little bit of context. What is reactive attachment disorder?
Is that where like you didn't get the reassurance that you wanted from your parent figure, so you connect very easily with strangers?
Yeah, and I wonder if that, as being part of Snow White's childhood, as a result of that maladaptive parenting, is itself a replay of what her own mother dealt with, and therefore why she might be fixated at and therefore regresses to the age of 5. Right, back to that Oedipal stage.
And she even says when she walks into the house, maybe they have no mother.
Right.
Something else just kind of going on with the cleaning scene. Sorry, just to clarify really quick, are we, like, just with the theme of, like, eating disorders, are we saying Snow White might exhibit that?
We didn't get there yet.
Oh, okay. Okay, so I guess if that's what we were going to talk about, then just kind of going along with, like you were talking about, like, what annoyed you at Snow White. For me, was that she just seemed like everything was, like, so happy and perfect and cheery and clean, and that kind of, to me, I guess, like, went along a little bit like the cluster C, like, personality types, like the obsessive compulsive and, like, dependent types, where, like, everything needed to be clean and spotless, and she always, like, put on, like, an outward energy of being, like, happy all the time and everything was perfect, even though, like, you know, that's not really the case, like, her mother trying to kill her and all the things going on at home. But I guess, like, if there is, like, a theme of, like, body image and, like, eating disorders, like, anorexia, I think, is typically associated with, like, perfectionism.
Yeah, I wouldn't dismiss splitting here either.
Okay.
Right? But yes, there is aspect of obsessive compulsive personality too. And what's interesting is that and I'm not sure we can, but if we were to formulate Snow White as a fictional case of eating disorder, maybe anorexia, if she were a restrictive subtype, then the obsessive compulsive personality traits fit perfectly. If she were binge eating and purging subtype, then the cluster B personality disorder traits would fit in perfectly. She does not appear underweight to me.
No. Sorry,
So-
I guess I thought someone had mentioned, but maybe that was me not very quickly.
If there's any opportunity to review and teach, we should explore, even if we decide that it's the wrong exploration and therefore the diagnosis is there. It's perfectly fine. The other part of it too, and if she were underweight, and I have to go back and look at the original because maybe Disney changed this for reasons that we had discussed before. Hypothetically, if she had been underweight in the original, and it might be on our to-do list this weekend to check into that, I might go with splitting and cluster B personality traits, and therefore the binge eating and purging subtype because of what happens with the apple at the end, right? Is that metaphorical of her eating and binging? Purging, excuse me. Anything else about Snow?
This is very minor and brief, but I don't know if we could actually put like a diagnosis to it. But after she's attacked by the man in the woods in the very beginning, and then she's running through the woods, and everything is like reaching out to her and grabbing her. Like, obviously it's very transient, but she's like going through like having a brief psychotic episode. So I don't know if that's like, if that would be like something you would consider like acute stress disorder, where that is kind of trauma. She's getting attacked. But it's more kind of evolving in like psychosis.
Yeah. I mean, we might just start out at a point that this is normative, and that this is the phenomenon that I had referred to last week as stress-induced psychosis. So under incredible amounts of stress, someone with no evidence of mental illness whatsoever can still believe that the forest is reaching out to them. So we could start there. We could definitely start there. There's also something suggestive of their, and let's say we're going to move off that point. Let's say you presented evidence to say, I'm not comfortable with saying that there is a normal baseline and that everything we see in that scene is stress-induced. So this is not stress-induced psychosis. I believe it's coming from a place of mental illness. If that were the case, what are the first two things that must instantly pop up in our minds as a clinician that we now need to investigate?
Getting past history, or
If we believe that scene depicts a mental disorder, what is the step? What's step 1 and 1B right now for us?
Determining how old she actually is.
No, well, that evidently we can't do that. You really suck at that. I like it. And forget about Snow White. This is any patient. I'm trying to drill into you that when a patient presents to you, or when we're consulted on a patient, I want you to enter that room thinking this is going to be normal. This is normal behavior, and then realize, well, it's not. We're going to move away from that point. This looks like it's consistent with a mental disorder. At this point, there are two things you must consider.
Medical.
And?
Substance.
Perfect. Given her age, whatever that is, and given her sex, she presents with two protective factors. That is Snow White, the film, is not about a psychotic disorder due to another medical condition. Right? Again, if she were an older male, we're going to talk differently. But I think it's reasonable to assume that this is not induced by an underlying medical condition. Substance. So there's two questions that I want to apply to any film you watch to address this. And I think this is readily applicable to real life, true cases. Number 1, is there any overt evidence? So again, the parallel here is it in the script? And if you're in a clinic, did the patient tell me, is there a report of this? So is there any overt evidence of the use of a substance?
She was picking wildflowers.
So that's loose.
Johnny Poppies in there.
Nothing obvious.
Well, it's a poison, right? Substance includes toxins. So I think you have to include this, right? So there's something going on here. Now, I don't know what the poison is. Anybody? I don't know if it would actually. I don't know if it's actually in the film, but it's in the book. Where is the poison in this apple? Where is it? Yeah.
The skin?
Yeah. Right. I think they actually say. I mean, literally, it's in the red part. Right. And again, we can get symbolic. If you went out and bought reds, what is that street slang for? Yeah. Yeah. And, she does have what appears to be a benzodiazepine overdose. Right. And love's first kiss might actually be very symbolic of what medication?
Naloxone.
Now, it's not going to reverse the effects of a benzo. Patient comes in with suspected benzodiazepine overdose. Good, right?
Flumazenil.
Yeah. Again, comes up on shelf all the time. Flumazenil would be the single best answer to reverse the overdose or intoxication effects of the benzodiazepine. Now, what would have been nice is if upon awakening, the next scene was her then running from him through the forest and having that experience, because what would that be consistent with clinically? Patient comes in for suspected benzodiazepine overdose. We'll even say that her name is Snow. She's provided flumazenil and then has a psychotic episode. I'm pulling right from the story, right? What's happening? What's one of the side effects of giving flumazenil? It could be seizure in the context of what? What's causing the seizure?
Withdrawal
Yeah. What from what?
from the benzo.
Yeah. A complicated benzo withdrawal, right? Because a complicated benzo withdrawal has the same signs and symptoms of a complicated alcohol withdrawal. And that could include seizure, but it could also include perceptual disturbances. Right? I think that this would be perceptual disturbances in the context of benzo withdrawal effected of the flumazenil precipitating that acute withdrawal state. So we got to rewrite the script. She's got to go through that forest after she gets kissed. Anything else? Let's stick with the symbolism. So let's cover one more potential substance-induced psychotic disorder. No? How about look at the title of the illness? Title of the story.
Is she imagining the door?
Yeah, she is. Why?
Is it related to, well, are you saying substance related?
Yeah. How?
No.
And it's beyond the simple substance-induced psychotic disorder. I want more detail now.
Looking at the title, Snow White, like physical power for like this sort of drug, like she's pale because of
Cocaine.
Yeah.
Oh.
Yeah. Now there's two mechanisms of action here. One is the direct physiologic effect of cocaine and other stimulants in inducing psychosis. We know that cocaine can do this during its acute intoxication phase. So that's fairly straightforward. Nobody really should have any problems with that. So the story of Snow White, titled Snow White and the Seven Dwarfs, the Seven Dwarfs not really being there, might actually be the effects of a substance, specifically snow, street slang for cocaine. But there's another mechanism that cocaine can induce these Lilliputian hallucinations. No? Are these Lilliputian hallucinations simple or complex? They're complex, right? They have formed borders. They do. Is Snow White demonstrating any clinically significant distress upon seeing or interacting with these Lilliputian hallucinations? Absolutely not. So we have a patient that is presenting with formed or complex hallucinations with significant insight. That is, there's inappropriate affect. What is that consistent with neurological syndrome? No? Charles Bonnet, right? What causes Charles Bonnet syndrome? What is the third part of the triad beyond insight plus complex or form hallucinations? What's the third part of that triad?
The vision.
Right. How could cocaine induce visual changes that itself may result in the Charles Bonnet syndrome?
Like vasoconstriction.
Vasoconstriction and resulting retinal detachment. Yeah, and that's a potential cause of Charles Bonnet. So maybe Snow White, the story, is a fictional account of psychosis, specifically drug-induced Charles Bonnet syndrome. That's if we take Snow White's name verbatim. All right. Any final thoughts about the story of Snow White?
I thought cocaine caused dilated. It's a stimulant.
It is a stimulant, and it could cause vasoconstriction.
You know the angina you get from
Yeah.
cocaine?
Yeah. But I thought that usually it causes dilation.
It causes dilation of the pupils, but
Yeah.
constricts the blood vessels.
Blood
around
vessels, blood
Oh, the
vessels.
blood vessels.
Yeah.
Sorry. I thought
Yeah.
it was talking about pupils. Okay, I see.
The two drugs that come up on tests. I mean, I dare to say this because you're facing a psychiatry shelf, but it's usually a neurology shelf exams are cocaine and opioids. Charles Bonnet. Final thoughts on Snow White. All right, we're about 1:15. Is taking a 10-minute break starting at 1:25 for our clinical case conference, okay? 10 minutes?